Oops. So thanks so much, and really very happy to be here, and thanks for the invitation. And I think that it's really a good opportunity for us now to work together and on this science policy interface and try to enhance this interface and reduce the gap. So how to make those research fundings translated into actionable information. This is what actually FAO is trying to work now recently on this science policy interface. What we present now is the Ribali fever early warning decision support tool, which is an example of an early warning tool where science has been translated into actionable information for the Ribali fever to anticipate and mitigate the risk of the disease. So this is used to guide informed early action for better prevention and control. The Ribali fever DST identifies climatic anomalies to forecast areas at risk of Ribali fever vector amplification. So vector amplification means that suitability is estimated predicted suitable habitat for vectors relevant for the and competent for Ribali fever transmission based on Earth observation data. The model is based on a dynamic environmental model developed by NASA that we have calibrated and optimized, has FAO. You know, we are not a research institution, and before working on this and develop this tool, we actually review a number of available models, and then we chosen the one that was really dynamic. This was done some time ago, so it's more than 10 years that we are working on that. What is important is on top of the risk modeling that of course can be always improved and needs to be always improved, updated, and we hope that we get help for having a better resolution in terms of spatial and also temporal domain. What is important for us is also to integrate expert knowledge. And this has been done for this tool by including and involving experts at the international, regional, and national level. Because at the end, the need that we understood was really to develop a tool that enable the member states to monitor the risk by themselves, have a kind of baseline risk map that is updated on a regular basis and on near real time, but that is integrated and enriched with information that is at local level, that at global level, let's say, or a central level is difficult to get. The prediction capacity of this tool and the model is about 1-2 months on average before the first case is observed. In some areas, it's even better. I forgot to say that the tool has been fully rolled out and is operational in Eastern Africa for Tanzania, Uganda, and Kenya, and now it's been expanded to other regions. Is integrated in a FAO geospatial platform, the end-in-end, and tomorrow my colleague will talk more about that. And is linked to the FAO EMPRESI database, which is a global animal disease information system at FAO, and in this case is linked to the Ribali fever events. So this tool that has been developed 3-4 years ago has actually facilitated real-time data sharing, is facilitating real-time data sharing, risk interpretation and consultation. And what is important also for us is that it's suitable to build capacity at national level. Has been designed in order to be scalable to other regions and also disease, and now we have a prototype for avian influenza as well. So on the right side, there are all the risk factors that are available on geospatial domain in the tool. From the environmental side and also to the socio-economic part, including animal mobility. We are moving on that domain as well. This is how it looks like. So we have a catalog where we have these risk factors available. An analytic tool where we can do some analysis to analyze and monitor the trend of the risk. the observed precipitation data as compared to the long-term average for different years, kind of radar charts that help the users. We need to understand that the user are the veterinary services, so the veterinarian in African countries. So a sort of charts that allow them to interpret the risk, which is depicted in the risk maps, which are updated on monthly basis. Now we are moving on having maps at weekly basis during the risk periods. We have reports on a monthly basis, which are useful for the user to have an overview of the information and summarize information of the tool. And if needed, we issue alert messages for the member states. And this is also done together with strategic partners, regional partners like IGAD in Eastern Africa. So we are moving towards from early warning to early action. And I mean, this tool has triggered key actions like heightening river valley fever surveillance. So we have risk-based surveillance that is implemented. Labs are equipped, pre-emptive action are also done. So target vaccination, for example, in Rwanda, they vaccinated a few years ago almost all the livestock, okay, is up. And here, so you can see all the kind of actions that are relevant for FAO, including the risk communication with the communities. What we need, what is the future development? Of course, we need better models, increased spatial temporal resolution, geographic extent. This is what we are doing in Western Africa and also Northern Africa. Predict the risk of spread. In terms of what also the Earth observation can help is to integrate those data in scenario and impact analysis. Madhur before has described that. Moving towards not only forecasting, but also nowcasting, and having ready to use information for upstream drivers and risk factors would be very relevant, including new proxies, so integrated indicators to also estimate, predict not only diseases, but also hosts like wildlife, livestock, and crops, forest, monitoring health in those domains. Those are publications that are available that summarize, our work. Thank you.